Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the common diseases of penis due to the disease of penis could be phimosis, paraphimosis, prepucia, calculi, injuries, strangulation, inflammations, priapism and neoplasms. Here I will discuss about some of the problems. Preputial calculi. In the late life, chronic prostatitis results in fibrosis, further constricts the already inadequate orifice of preputial sac. When the prepuce has not been retracted nor its interior cleaned for many years, preputial calculi may be formed. There are three types of calculi formed from inspissated smegma, mixture of smegma and urinary salts, containing only urinary salts. Treatment. The treatment of choice is the circumcision. Injuries. The injuries of penis may be avulsion of skin of penis and fracture of penis. Avulsion of skin of penis, entanglement of clothing in rotating machinery causes majority of these injuries. Treatment. Repair includes the burying the shaft of the penis in the scrotum and subsequent surgical release at a propitious time. Fracture of penis. It is very uncommon accidentally due to possible downward bending of erect organ. Following trauma, the erect organ suddenly becomes flaccid. The extravasation of blood, which is considerable, causes great pain and swelling. Treatment. In early cases, incision and clearing blood clot and suturing of ruptured corpus cavernosum has yielded good results. Chordae. Chordae is a fixed bending or bowing of the penis. The reasons may be hypospadias or acutely as a result of general urethritis. Erection is greatest and very painful. Treatment. The treatment is the stilbestol 6 mg daily. INDURATIO-PENIS-PLASTICA. PEYRONI'S disease occurs in patients with the age of above 40 and without a history of venereal disease. To start with, pain and curving of penis on erection cause the patient to seek advice, but after a few weeks the pain disappears. On palpation, an indurated plaque can be felt on the dorsal surface of the corpus cavernosum. The condition is slowly progressive and sometimes extend across the midline. Etiology is not clear, but trauma may be the possible cause. Treatment. There is no specific treatment. In some cases, there is a tendency to solve a resolution over 3 to 5 years. Persistent priapism. In this condition, the penis remains erect and is painful. One of the reasons may be idiopathic thrombosis occurring in the prostatic venous plexus. Rarely it is associated with leukemia or sickle cell anemia. Secondary malignant deposits in the corpora cavernosa or in the pelvis may be the reason for some cases. Rarely the reason may be spinal injury or disease. A low spinal anesthesia will cause a priapism of neurogenic origin temporarily. Treatment: anticoagulant therapy along with adequate sedation for 14 days bring about restitution in many cases. If this attempt fails, the repeated aspiration of the corpora cavernosa is of value. If it fails or not satisfactory, a small incision into the corpus cavernosum should be made to evacuate blood and the clot. If gangrene occurs, amputation is necessary. That's all about the minor diseases of penis, and in the next video I will discuss about some other disease. Thank you.